Good afternoon, everyone, and welcome to my Friday message. It's been a while, so we have a few things to catch up on. Let me start with updates about COVID. After 2 months of steady decline in COVID cases, the number of cases has begun to edge up in some areas across the U.S., largely due to the Omicron subvariant BA2, which the CDC now reports is responsible for 85% of the increase in cases. Case numbers in North Carolina, however, remain flat. And just to remind you about BA2, it's widespread in other countries, particularly UK. It's more transmissible compared to the original Omicron variant, BA1. And a UK study showed increased household transmission comparing BA2 to BA1 of 13% versus 10.3% respectively. In terms of current vaccine effectiveness against symptomatic disease, it's similar between the two variants. While 2 doses are 9 and 13% effective against symptomatic infection, protection markedly increases with a booster for both, as reported in a recent New England Journal study. In fact, efficacy against symptomatic infection jumps to 63 and 70%, respectively, and that holds true for serious disease and death. In fact, the number of antibodies that recognize BA2 are even higher in people who have been vaccinated and then infected with the original Omicron variant. While the response to the first booster wanes with time, a recent Israeli study demonstrated an additional booster restores effectiveness. There's also further loss of effectiveness of therapeutic antibodies with this Omicron variant. In fact, while the sotrovimab maintained its effectiveness against BA1, several lab studies have now shown loss of ability to neutralize the BA2 lineage. However, the antiviral Paxlovid maintains effectiveness against both 1 and 2. So at Duke, we have seen a slight increase in COVID cases among employees in the last week, with 40 new cases compared to 25 new cases last week. And we're also seeing a slight uptick in cases in students. So far this week, there are 81 total cases of COVID among students, with 94 students in isolation compared to 51 last week. These upticks likely reflect the continued circulation, now of this variant, with an increased infectivity and the loosening of mitigation strategies. Hospitalizations and deaths from COVID in North Carolina and across the country continue to decrease. The number of hospitalizations with COVID now at its lowest number since the first week of the pandemic in 2020. However, we'll be watching these numbers closely the next few weeks. The uptick in cases in certain areas has resulted in some amended policies. For instance, Philadelphia announced it was reinstating its mask mandate because of rising cases, and a few universities have reintroduced masking mandates. Currently, North Carolina, Durham, and Duke have not amended their mask mandates. As a reminder, at Duke, masks are currently not required unless on public transportation or in classroom settings. I want to emphasize that in the absence of a mask mandate, masking is an individual choice based on personal risk and decision-making, and those who wish to should continue to wear a mask. And as always has been the case, anyone who is infected with COVID or has been in close contact with someone who is infected should wear a mask for 10 days when they're in contact with others. Lastly, we know that vaccination works to protect against severe illness, and that is vaccination and booster. There is recent updates regarding boosters. On March 29th, the FDA and CDC authorized second booster shots of the Pfizer or Moderna vaccines for those over 50 who have had their first booster and now are at least 4 months out. Duke is now offering that second booster shot of the Pfizer vaccine for eligible faculty, staff, and students over the age of 50, as well as anyone who is considered severely immunocompromised. The second booster shot is not currently required for Duke students, faculty, or staff, but it is offered as an option for those who are eligible. The second booster shots are available by appointment or walk-in at the Duke Medical Pavilion, Duke Clinic 1J, Duke Regional Hospital, and Duke Raleigh Hospital. For more information or to schedule an appointment, visit the Duke COVID vaccine website and see the URL on the slide. Those eligible can also seek vaccination boosters at local pharmacies or with their healthcare providers. Duke has also updated surveillance testing guidelines. Surveillance testing of students ended in March. Required testing and daily symptom monitoring for unvaccinated faculty, staff, and students will end May 1st. That said, testing for students, faculty, and staff experiencing symptoms of COVID-19 will continue to be available through student health, employee occupational health and wellness, or with an outside provider. Let me end with some exciting news. Duke announced last week that Christopher Beyrer, an internationally recognized epidemiologist who has worked on the front lines of HIV/AIDS, COVID-19, and global health equity, will be the next director of the Global Health Institute. Dr. Beyrer will be a visionary leader for DGHI, expanding on the work already underway and opening the door for new opportunities. He will join us in August. So welcome, Dr. Beyrer. Also, our new chair of neurosurgery, Gerry Grant, returned to Duke from Stanford to assume this leadership position April 1st. So Duke recently announced 2022 recipients of the Duke Presidential Awards. These awards recognize individuals and teams from the university and health system who best demonstrate the values that define and shape Duke as an institution: respect, trust, inclusion, discovery, and excellence. Congratulations to several groups and individuals in the School of Medicine who received this wonderful honor. Duke Health's medical intensive care units, these teams of nurses, respiratory therapists, pharmacists, physicians, and advanced practice providers have cared for the sickest patients during the pandemic. Congratulations also to the Active 3 clinical research team. During the pandemic, this group of pulmonary critical care physicians, infectious disease specialists, residents, and administrative staff quickly mobilized clinical research trials on an innovative stem cell therapy and 5 treatments involving monoclonal antibodies. Congratulations also to Employee Occupational Health and Wellness COVID response team for their outstanding commitment and efforts to keep Duke faculty, staff, and students safe and well. Finally, let me congratulate 2 individuals who received recognition: Maureen Cullens, Director of the School of Medicine Multicultural Resource Center, and Geeta Swamy, Associate Vice President for Research and Vice Dean for Scientific Integrity in the Office of Scientific Integrity. Both are so deserving of this honor, which recognizes their outstanding leadership and commitment to excellence. These awards are wonderful recognition of our faculty, providers, trainees, staff, and students. Congratulations to all the recipients. I'll be back soon to continue sharing good news. Thanks to everyone for all you do, and have a great weekend.